Chapter 14, Emergency Medical Responder. Bleeding, shock, soft tissue injuries. All right. Damage to internal soft tissues and organs can cause life-threatening conditions. Internal bleeding results in shock. Shock is a state of collapse, the cardiovascular system, that results in inadequate delivery of goods to organs. More trauma, patients die from shock than any other condition. You must remember shock is defined as the inability to deliver adequate oxygen to the vital structures, inadequate perfusion. As always, before we treat a patient, we always do a scene survey, scene size up, hazards, and we go on to the primary survey. Okay, is the patient alive or dead? Does he have any life-threatening conditions which we need to treat first before we can continue? Followed by history taking, secondary survey, sample and dots, a careful assessment of the patient, and then continual reassessment. Okay, when we look at the scene survey, we always look for hazards, both yourself and the patient and people around you. All right, you may have to stop the primary assessment to see if there's too much blood. We need to always control the blood, bleeding, breathing, and other injuries. During the secondary assessment, be alert for signs and symptoms of shock from internal or external loss of blood. Okay, some of the signs and symptoms you would see when reassessing your patient would be your vital signs. Things like pale skin, increased pulse rate, a weak pulse rate, decreasing blood pressure, which would cause that weak pulse rate. Okay. The concept of standard precautions assumes that all body fluids are potentially infectious. Therefore, you have to wear gloves. Maybe a surgical mask and eye protection should also be considered. Okay. In context of the pandemic, we need to be too careful for airborne pathogens as well. All right. When we're talking about shock and delivery of oxygen and nutrients to the body, we'll think of the heart, the lungs, the blood, the air that moves in and out. Remember, right receive, left leave, always comes in on the right hand side of the heart, always leaves from the left-hand side of the heart. You can see from the wall of the muscle of the heart here that the left is much stronger, bigger, because it has to pump the blood a lot further under pressure. Okay, the heart functions as the main circulatory system of the pump. Heart consists of 4 separate chambers, 2 upper chambers, left and right atria, 2 lower chambers, the bottom of the heart, left and right ventricles. You can see there's blue, inferior and superior vena cava entering into the right atrium. Okay, and red aorta leaving from the left ventricle. All right. Between the veins and the arteries, there's venules and arterioles, little capillaries, and that is where exchange of oxygen and nutrients and the removal of waste products takes place. Arteries carry blood away from the heart under pressure. Capillaries is a network that distributes the blood, and veins return the blood from the capillaries to the heart. Okay, the body, the fluid, the blood, the liquid part of blood is called plasma. You have red blood cells. Okay, they have hemoglobin. They carry oxygen and take out carbon dioxide. White blood cells are your soldiers. They consume the bacteria and viruses and combat infections. Platelets form clots and help to stop bleeding, called thrombocytes. Pulse is a pressure wave generated from the pumping action of the heart. In a conscious patient, it can easily be found in the radial pulse of the wrist, just below the base of the thumb, between the tendon and the bone. Okay, if the patient appears to be in shock or unconscious, attempt to locate the carotid pulse first. In other words, in the neck, 2 fingers down from the angle of the jaw, just behind the Adam's apple, you will find a good strong pulse if he's alive and heart beating properly. Shock, like I said, is inadequate perfusion. Inadequate perfusion is brought on by the inability to deliver oxygen to the vital structures of the body. 3 primary causes of inadequate perfusion or shock would be the failure of the pump. In other words, the heart's not pumping blood properly around the body. failure of the pipes, the cardiovascular system, the vasos, in other words, the veins and the arteries, especially the arteries, dilate uncontrollably, and the vascular container becomes bigger than the amount of blood that it has inside of it. And then obviously the third one would be loss of body fluids, something like hypovolemic shock, stab wounds, gunshot wounds, explosions, amputations, severe arterial bleeding would cause rapid loss of blood and would lead to hypovolemic shock. Cardiogenic shock, okay, this is the heart again. If it doesn't pump properly, okay, get enough blood, the cardiogenic shock occurs if the heart cannot pump enough blood to supply the needs of the body. Failure of the heart can result from heart attacks. Now, there's many different types of heart attacks you can have, but let's just talk about it in general. Inadequate pumping of the heart can cause blood to back up in the blood vessels of the lungs, resulting in congestive cardiac failure as well. All right, failure of the pipes, in other words, the blood vessels. Pipe failure is caused by the expansion of capillaries as much as 3 or 4 times their normal size. Blood pools in these capillaries and the rest of the body is deprived of blood. Blood pressure drops quickly and results in shock. Shock induced by fainting or psychogenic shock. Fainting is the body's response to a major psychological or emotional stress. As the nervous system reacts, capillaries suddenly expand dramatically, and fainting is a short-term condition that corrects itself once the patient is placed in a horizontal position. Okay. People that stand a lot, if you get a big fright, adrenaline kicks in. It causes the blood vessels in the leg to dilate, allowing lots of blood to get to the muscles in the leg so you can run away. However, if you can't run, you're too scared or something like that, fainting occurs because the blood is not returned to the head. So oxygenation can take place of the brain cells. Anaphylactic shock is an extreme allergic reaction caused by a foreign substance, usually a type of protein or poison that is ingested or injected into the body. Patient appears flushed. Okay, breathing can become difficult. Blood pressure drops rapidly. Swelling of their face, neck, things like that can take place, and death is quite quick if action is not taken. All right, failure of the shock. Pipe failure is also septic shock. Leaky and porous blood vessels dilate due to overwhelming infection throughout the body. A life-threatening emergency often occurs in older adults. It's also a thing you don't often see in a pre-hospital environment. It's usually post-operative infection or something like that in the wounds, and then the patient starts to get these signs and symptoms, and you need to react quickly before it's too late. Spinal shock or neurogenic shock occurs when there's an injury to the spinal cord. Okay, it allows the capillaries to expand, the blood pools below the level of injury, and the blood is obviously not going to the brain in that case. Brain, heart, and lungs and other vital organs are deprived of blood, resulting in shock. Fluid loss or excessive bleeding, hemorrhage, hypovolemic shock. Okay, blood escapes from the wound and the system's total fluid volume drops. Okay, the heart begins to pump faster to try and maintain the pressure in the pipes. The body also constricts the vessels, blood vessels, in order to keep the blood pressure up. Eventually, it becomes too much for the body to constrict these blood vessels. We then have a situation of decompensated shock. The pump eventually stops pumping as a result of cardiac arrest because there's no oxygen and nutrients going to the cardiac muscle. So it is cardiogenic shock. Okay, fluid loss continued. Okay, external bleeding is not difficult to detect, but with internal bleeding, you can't see what's going on. You can look for signs, excessive signs of bruising on the outside or swelling. Rigidity. If the abdomen is filling up with blood, you'll feel it becomes hard and distended. There may be severe pain in the immediate area of the abdomen where the wound or trauma has taken place. Whether bleeding is internal or external, if it remains unchecked, it's sure likely to cause death. Okay, shock will be pump failure because there's not enough oxygen going to the brain and to the heart muscles. An average adult has about 12 pints of blood, 6 liters of blood circulating in the body. More accurately, about 71 milliliters per kilogram of blood. Okay, a loss of 1 liter can lead to shock. Without being corrected, a little bit more than that would definitely cause hypovolemic shock and possible death. Signs and symptoms of shock, okay, generally all the same for all the different types, 8 different types of shock that you can get. But it just means that the body is deprived of oxygen, okay, so there's no perfusion to the cells. Signs and symptoms include confusion, agitation, restlessness, anxiety. The first thing you'll see on a patient who is in shock would be the pale, cold, clammy skin, almost grey-looking skin. Looks like the life is drained out of their body. Okay, no more symptoms and signs: shallow breathing, low breathing, weak pulse, increased capillary refill time. In other words, when you do capillary refill, you squeeze the fingernail bed for 5 seconds, goes from pink to white, needs to go back to pink in 2 seconds in order for there to be sufficient capillary refill. Nausea and vomiting is always a problem with shock. Patient is feeling weak and thirsty and may also become unresponsive, comatose, and die. It's important that we position patient correctly. If the patient has no injuries or extreme discomfort or difficulty breathing, lay the patient on their back and elevate the legs to allow the blood to flow back to the body. Maintain the ABCs, airway, breathing, circulation. Remember always, if those fail, you may need to revert back to CPR, cardiopulmonary resuscitation. Try and determine the cause of shock. Okay, and maintain the body's temperature. Do not allow the patient to eat or drink because this may cause vomiting. Patients in shock may need surgery and should not have anything in their stomachs at the time. Okay. Always, if trained to do so, give oxygen. Okay, we need to alert the EMTs and things like that to arrange for extra fluids, arrange rapid transport to hospital. If I can suggest we use the term wafer when treating shock patients, warm the patient, make sure that there's plenty of air, 0 fluids, none, nil per mouth, always a good bet. Elevate the limbs and calm and reassure the patient, bring down his blood pressure, get them breathing, nice, even nasal breathing, so that they calm down, don't bleed as fast as if they are bleeding, things like that. Okay, treatment for shock caused by pump failure. Pump failure is a serious condition, and proper treatment and prompt transport by ambulance to appropriate medical facility will give these patients the best chance of survival. Okay. Anaphylactic shock, treatment for anaphylactic shock. Obviously, the quicker you can transport them to hospital, the better. Some patients may have an auto-injector or an epinephrine injector. Assist the patient if your local protocols allow it. And if you've been trained, when you're using an auto-injector, always remove the caps. Okay, locate the thigh muscle, a big muscle in the leg. Push the auto-injector against it. If it's got a red cap, red to the leg, and then hold for 10 seconds. You must hear it click. Don't bounce, don't move the pen for 10 seconds at least. It's a very fine needle. It takes at least 10 seconds for the adrenaline that's inside or epinephrine inside the auto-injector to inject. Once you've finished with the injection, ensure that you always dispose of the pen correctly. Remember, the needle may be exposed. Right. With neurogenic shock, try and keep the spine in a neutral position. Remember, support the ABCs and treat for shock. Arrange from transport to the appropriate medical facility. Remember when we're looking at broken spines, necks, things like that, cervical injuries, 3, 4, and 5 will keep you alive. The arteries, the neurons or the nerves that keep the airway open and moving and control the diaphragm come out at 3, 4, and 5. So if you break your neck lower than that, or you have a neck injury lower than that, you can be all right and continue to breathe despite your injuries. Treatment for septic shock, okay. ABCs should be supported, wafer, and arrange rapid transport to medical facilities. There isn't much you can do as a rescuer in the treatment of shock. Just try and keep the patient comfortable, keep the patient warm, and reassure and calm the patient. 0 fluids, 0 per mouth. Must remember these patients will all be thirsty and looking for something to drink. Shock caused by internal blood loss, bleeding, stomach ulcers, ruptured blood vessels, tumors, and obviously aneurysms and things like that can be very severe and very quick. Patients with internal bleeding may exhibit things like coughing, abdominal tenderness, okay, rectal bleeding, vaginal bleeding in women, and classic signs of shock: pale, cold, clammy skin, shortness of breath, nausea and vomiting, weak, rapid pulse, shallow, ineffective breathing, all those things like that. Remember, when in doubt, get help. Always get help. Shock is what kills you at the end of the day. All right, bleeding and bleeding emergencies. We get 3 types of bleeding, external bleeding anyway. Capillary bleeding, slide A, when you cut your finger. Slide B, venous bleeding, when a vein is severed, dark red in color, flows steadily from the wound. We have about 7 to 10 minutes to stop the bleeding. Arterial bleeding, it's bright red, pumps out in the time of the heartbeat. It's a critical injury. Bleeding has to be stopped within a couple of seconds in order for the patient to survive. Capillary bleeding being the most common type of bleeding, blood just oozes from the wound. Direct pressure would usually stop the bleeding. Only time you would have something that's not working like that is if you have some type of blood thinners or have a bleeding disease like hemophilia. Venous bleed, second most common type of bleed. The blood flows steadily from the wound. Apply direct pressure for at least 5 minutes, 5 to 10 minutes, I would say, to stop the blood. If it's a serious bleed, it might take a bit more pressure and a bit longer. Arterial bleed is the most serious type, eh? Blood squirts out in time of the heartbeat. Sometimes you can't notice it because there's a flap of skin or something. It just looks like it's coming out, generally red, bright red in color. If on close inspection of the wound and you put it and look at it, you may have blood squirting out there. So you need to apply pressure. You're never ever going to, I'm not going to say never ever, but 9 times out of 10, you're not going to be able to control that bleeding just with normal pressure. One would have to use something like indirect pressure, blocking off the blood flow above the wound, where at the pressure point where a pulse crosses the bone. You may also, as a last resort, prepare to use a tourniquet. Remember, when using a tourniquet, always make some sort of mark on the patient to show that he has used a tourniquet. The tourniquet is in place and is controlling the bleeding, so that nobody accidentally loosens it or that they don't leave it in place for too long before the patient gets treatment or help. Well, it's important that we need to get help as soon as possible for bleeding, especially arterial bleeding. Direct pressure on a wound, place a dry sterile dressing directly on the wound and press with a gloved hand. We all assume that by this time we know that we have to wear gloves before we even touch or think about touching a patient. Rapid dressing around the wound, trying an X motion, X over the wound so that it applies as much pressure as possible. Do not remove the dressing after applying it. If blood seeps through the wound or through the dressing, apply another direct dressing over it and apply pressure for as long as possible. Always remember, when splinting or bandaging something, make sure there's distal circulation. That's checked in the capillary refill time. However, if you've used a tourniquet there will be no circulation in that limb, because the whole role of the tourniquet is to stop the movement of blood so that the patient doesn't bleed to death. There we go. Direct pressure, elevate. By elevating the limb, the blood doesn't flow as fast up the limb, and we can always direct the pressure, the blood flow back to the body that way. Application of a tourniquet. Okay, once the tourniquet is in place, tighten it until the blood stops. Mark the patient's forehead at least with a T, and make a note of the time which you applied the tourniquet to him. Hemostatic agents are a new thing that's come out recently. They've been military approved. They provide rapid blood clots. Usually the gauze is impregnated with the powder or substance. You see things like quick clot, Cartazan, those kind of things. You can pack it into the wound rapidly. It forms a blood clot and stops the blood from flowing out. Very useful in extremity wounds and junctional areas, the groin, the shoulder, armpit, neck, things like that, where tourniquets can't be applied. Insert a bit of hemostatic dressing, apply pressure, keep the pressure on, allow blood clots to form, and then arrange rapid transport to hospital. You can put a dressing over it. You can put a dressing to keep it in place as well, but pressure, pressure, pressure. Standard precautions when bleeding control: gloves, gloves, gloves. Goggles and maybe face shields are important. Remember, diseases such as hepatitis, HIV, things like that can be spread in blood and other bodily fluids. Gets into your eyes, there's no prevention of it getting into your bloodstream. Always wash both hands, the blood off your hands. If you happen to, unfortunately, get blood off your hands, use soap and water. Otherwise, use a sanitizer, a waterless sanitizer with an effective germ-killing agent. Okay, a wound is caused by any physical means. It leads to damage to the bottom part of the body. Wounds can be classified into open and closed wounds. A closed wound is where trauma takes place against the skin. The skin is not broken, recognizable by a bruise or contusion. A soft tissue injury is where small blood vessels are broken. The area becomes discolored and swells, and the simple bruise heals quickly. Remember, bruising and swelling may be a sign of underlying fractures as well. Things to keep an eye out for, things like hematomas, where there's severe bleeding under the skin. Maybe the broken bone is broken and broken through the blood vessel or something and causing it to bleed in the wound. All right, open wounds, abrasion. Abrasion is also called a scrape, road rash, rug burn, things like that. Occurs when the skin is rubbed across the rough surface, or when it is rubbed across the surface and it gets hotter and hotter until it burns or wears through the skin. Things like road rash, tar burn, things like that, grass burns, those kind of things. Puncture wound. Puncture wound occurs when the object penetrates the skin. It may be still stuck in there. Remember, if the object is in the wound, do not remove it. We never remove objects from wounds. We always stabilize in place and stop the bleeding. There we go. There's the proverbial, I've nailed it. Okay. Always secure in place with bandages and dressings. Don't allow it to hook on things, and arrange transport to a hospital. Puncture wounds could also be things like dog bites, snake bites, gunshot wounds, things like that. Don't forget those, eh? Laceration is the most common kind of type of wound, commonly called a cut. Minor lacerations require little care, but large lacerations can cause extensive bleeding and even be life-threatening. You'll find with a laceration, there's lots of nooks and crannies for the blood to clot. So clotting or control of bleeding is slightly easier than dealing with an incision. Here's an example of the lacerations, tear in the skin. Always looks really gross and really difficult to control, but just keep your head, control the bleeding, and let the paramedics take care of the rest. Avulsion or an amputation is where the skin is torn away from the body, a large flap of skin. Okay, it's a traumatic, or wound is called a traumatic amputation. Okay, amputated part should be located, but first stop the bleeding. Bleeding, bleeding, bleeding. Put a tourniquet, a tight bandage, something around the wound to stop the bleeding. Locate the amputated part, clean it, put in a sterile bag with a dressing around it. Okay, keep it cool, not freezing it. We don't put it in ice. We don't ever put anything in ice. Okay, and take to hospital with the patient. You should put the name of the patient on the bag and the time of amputation, or as close to it as possible. Okay, both parts, patient and amputated limb, should go back to the hospital together if possible. Whereas an avulsion, it's a large flap of skin. Significant bleeding is common, and there will be tissue damage, nerve damage, and definitely vascular damage in something like that. Treatment of minor bruises is no treatment. You can apply ice in a cloth, gently elevate the injured part if it's possible. A splint or major contusion, stop bleeding as quickly as possible using the cleanest dressing available. All right, dressing and bandaging wounds. Control the bleeding by placing a gauze over the injured area. Apply pressure 10 to 15 minutes. 5 to 10 minutes, sorry. Okay, and immobilize any foreign objects which are impaled in the area. Dressings is an object placed directly on the wound to control bleeding and prevent contamination. Remember, I told you there was hemostatic dressings we could put in the wound to assist with blood clotting and stop major arterial bleeds. Examples of dressings for you. Okay. Always remember, when splinting or bandaging hands, arms, elbows, shoulders, we need to use a sling as well to support the injured arm. Okay. Always remember the principle of ensure the bandage dressing covers the wound completely and extends beyond the sides of the wound. Wrap the bandage tightly enough to control the bleeding, but not so tight to cut off circulation. Check for circulation regularly because wounds do swell. There's a chance that once you've got the dressing on 10, 15 minutes later, you may need to loosen it and reapply it so that it's not so tight and there is circulation. Remember, don't take the dressing off, just loosen the bandage. Okay, secure bandaging so that it cannot slip. Please don't use pins and things like that. If you have to, use a bit of tape or elastoplast or something directly on the bandage. Remember, people can be allergic to plasters and elastoplast and things like that. Standard precautions occur, definitely need to be used. Gloves must be used, goggles, face masks, things like that. Always remember, with face and scalp wounds, facial injuries, even though it's very small, it appears to be a huge wound because of the large amount of bleeding. One must remember that there's lots of nerve endings in the face, lots of little muscles and fine motors, skills, things like that. And with those fine neurons, there must be lots of blood to supply oxygen and things like that to those parts. Therefore, if you have an injury to the face or the scalp, it's usually going to bleed quite a lot. Direct pressure to the skull must be done gently as possible. Remember, we need to be aware that there could be a broken skull underneath it, and we do not want to push any bone fragments or anything into the brain at any point in time. So just be aware of that when you are applying pressure to a head wound, and make sure that you're not doing more damage than doing any help. All right, there we go. A roller bandage, a donut, if you've got one, to apply pressure around the outside of the wounds. Always use a triangular bandage. It's much easier to attach said dressing to the head. Obviously, if there's wounds in the cheek or in the inside of the mouth, you can put a small piece of gauze against it. Apply pressure. Always remember that if you're putting anything inside the patient's mouth, there's a good chance that if he becomes unconscious, he's going to choke on it. Always make sure the airway is kept open, but try and stop the bleeding at the same time. Beware of sticking your fingers in people's mouths. Okay. Scalp lacerations and associated skull fractures and brain injuries. If any brain tissue or bone fragments are visible, do not apply pressure. Cover the wound loosely arrange rapid transport to hospital. Okay, with head injuries and spinal injuries, try and immobilize the neck, stabilize the spine, the C-spine as much as possible, monitor the airway, breathing, and circulation, always protect the spine. If you have to, don't let the head go. Keep it, hold it permanently until help comes. Nosebleeds can result as a result of injury, high blood pressure, or dry air. Environmental situations do sometimes affect the nose. Okay. Nose can bleed without any apparent reason. Okay, no apparent cause. Called a spontaneous nosebleed. Unless the patient is experiencing shock, have the patient sit down, tilt the head slightly forward, pinch off the nose from the soft cartilage where it touches the bone, and apply a ice pack to the back of the head. All right. At least 5 minutes. If the nosebleed persists or is very severe, arrange rapid transport. Always remember that once the bleeding has stopped with a nosebleed, encourage the patient not to cough or sneeze or blow their nose for quite a long period of time afterwards, because that sudden force or pressure in the nose could start it off bleeding again. Okay, but nosebleeds generally stop within 5-10 minutes if you've got an ice pack on the back of the head and pinching the nose closed in front. You could also put ice on the forehead as well if you have an extra pair of hands to hold it in place. Always remember, ice should be in a dressing or in a cloth, not directly on the skin. All right, eye injuries. For just a dirt or a small foreign object on the surface of the eye, we need to make sure that we just flush with a saline or non-irritant liquid. If we're out in the field, just bottled water would do. Make sure it's clean, and if necessary, put a dressing over the eye to protect it. All right, with an impaled foreign object in the eye, remember, it doesn't have to be as big as this pencil. It could be just a short piece of steel, a shard of steel from a welding accident, or not a welding accident, a grinding accident or something like that. Just a small shard of steel could end up in the eye. Always remember to cover both eyes. Eyes move together. Okay, the one moves, the other one always moves with it. So if you cover both eyes, there's less chance of eye movement and less chance of injuring the eye further than it is already. Always remember, there's nothing you can do. Arrange rapid transport to a appropriate facility. Neck wounds, always everybody's afraid of these. Direct pressure to control bleeding. Once bleeding is controlled, dress the neck. Okay, don't be shy to use your hemostatic dressings on large wounds. In rare cases, you may have to insert or exert finger pressure above and below the site to prevent injury or bleeding, Major trauma to the neck may be associated with airway problems in the neck, spinal fracture, or spinal cord injury. Stabilize the patient's airway and stabilize the head and neck. But believe me, bleeding, arterial bleeds. Carotid arteries are very hard to maintain or stop the bleeding on. Okay, pressure above and below the neck with the injury, hemostatic dressings, rolls of bandages placed in there, tightly wound, not around the neck, but down, around, under the arm and back up and around the neck again. Always encourage the patient to pull their arm down and pull the dressing tighter. Back and chest wounds. Obviously, if there's an open chest wound, a sucking wound, we need to close it as soon as possible to prevent the air from rushing in and making the lung collapse. Tension pneumothorax. Patient may be coughing up bright red blood. Cover open chest wounds with airtight material, inclusive dressing. Administer high flow rate of oxygen. Okay, calm and reassure the patient. Treat for symptoms of shock if they appear. All those ABCs. If ABCs don't work, then obviously CPR. Patient's breathing becomes labored. You may, after you seal the wound, remove the seal on the wound briefly. Allow the air to escape and then reseal the wound if that's necessary. You may also see signs and symptoms, okay, for chest wounds. If there's a collapsed lung, tension pneumothorax, and it's been a while, you may start to see things like dyspnea, difficulty breathing. Things that come to mind when I talk about difficulty breathing would be signs and symptoms, use of accessory muscles in the neck. Okay, tracheal deviation. Trachea will move away from the injured side of the body. Okay, if this is the case, try and open the wound up again, remove the dressing, allow the air to escape so that the lung could reinflate, and monitor closely. Treat the patient for shock. Shock is going to kill this patient if he doesn't get help soon. Impaled foreign objects. Remember, stabilize the object. Never, ever, ever remove an impaled foreign object from the body. You don't know which blood vessels are being occluded, stopping the bleeding from coming out, major blood loss and things like that. Always remember, we're going to dress it, stop the bleeding, control the bleeding, and arrange rapid transport. Remember, closed abdominal wounds could be anything from baseball bats to seat belts, things like that. Check for bruising, other marks, going to the thing. Tenderness and swelling, black dots, deformities, open wounds, tenderness and swelling. If possible, if there's no injury to the back or spine, elevate the legs and keep the body warm, please. You know, avoid shock, always treat for shock. Shock, shock, shock. If the patient is vomiting blood, this may indicate bleeding from the esophagus or stomach. Monitor airway and vital signs. Give the patient nil per mouth. Standard treatment for shock. Arrange prompt transport to hospital. There's nothing you can do except maybe calm and reassure the patient. If you know, can pinpoint a spot where it might be bleeding or something like that, you may want to apply light pressure to the area, try and slow the bleeding down in that spot. Open abdominal wounds resulting in slashing of knife or other sharp object if the intestines are protruding. Okay, place the patient on his or her back with the knees bent. Cover the injury with sterile dressing. Do not attempt to place the intestines. Place intestines are lying on the ground. Gather them up, rinse them off with some water, sterile water if possible. Place a clean sterile dressing over the top. Put some plastic over it, cover it, secure it in place, and arrange rapid transport to hospital. With abdominal visceration, where the intestines are out and things like that, always expect shock and vomiting. And be prepared for these things. All right, genitals, male and female genitals have a rich supply of blood. We all know that it's vitally important to keep them healthy. So if there is bleeding or anything, apply direct pressure with apply direct pressure with a sterile dressing. Although it may be sometimes embarrassing to examine a patient's genital area, you need to kind of suss out where the injuries are so that you can help stop the bleeding. Remember, there's nothing you can do for a PV bleed. Apply a pad or something like that to stop the bleeding or to do things, and then just get the patient to hospital as soon as possible. Okay, extremity wounds. Okay, we always apply dressing, bandage, compression, secure in place, elevate the injured parts to decrease this bleeding and swelling, and splint all injuries to extremities, and arrange rapid transport to hospital if there's underlying fracture. There's an extremity wound, arms or legs. Secure in place, stop the bleeding, roughly 10 minutes to stop normal bleeding, and organize transport. Gunshot wounds, most deaths from gunshot wounds result from internal blood loss. Gunshot wounds to the trunk and neck can cause spinal cord injuries. Make sure the airway is open, adequate ventilation and circulation, and stop the bleeding. It may be necessary for you to pack dressings inside large open wounds. Do so and apply pressure and arrange transport. Obviously, if ABCs fail, perform CPR if the patient's heart stops, but never give up. Try and do something. Bites always carry the risk of infection. Okay, for small minor bites, treat and soap and water, clean it. For major wounds, control the bleeding, apply dressings, and seek medical attention. Burns, burn wounds are important because the skin is a barrier that prevents foreign substances from entering the body. More importantly, the skin also controls the loss of body fluids. When the skin is damaged, we can no longer perform these essential functions. Okay. If it's a first-degree burn or superficial burn, there'll be redness and painful areas to the skin, such as sunburn. A mild thermal burn will also cause redness of the skin. Remember, in infants, even the slightest burn will cause the skin to become damaged, and the surface will also be open. With a second degree or partial thickness burns, okay, you will find that there's blisters forming, there's tissues to the top layer of skin, fluid loss could be moderate to severe. It could also be very painful. Remember, the size of the burn on a second degree burn is more important than the depth of the burn. It takes a couple of weeks to heal. The skin heals from underneath, and always keep it clean, keep the germs out. Okay. Third degree burns, or full thickness or full dermal burns, okay, is severe damage to all the layers of the skin. Pain is absent because the nerve endings have been destroyed. Patients with large quantities of body lose large quantities of body fluids and are susceptible to shock and infection. Up to 1/3 of the, or yes, 1/3 of the rule of nines, up to 1/3 of the skin could lead to shock and death. All right, always remember that the body's front or back or legs is 18% for each leg. 1/3 of that, 2 legs injured, would cause significant loss of body fluids. Okay. There's the rule of nines, slightly modified for babies and for children, but generally speaking, 18% for legs, 9 and 9 for each arm, 18% for the back, 18% for the front of the body, and 9% for the head, 1% for the general area. All right, types of burns or causes. Thermal burns are caused by heat. Place burnt area under clean, cold running water. 10 to 20 minutes. Cover with clean, sterile dressings. Okay. Burn shield is well advised to be used in this type of situation. Don't break the blisters. Treat for shock and transport to hospital. In fact, if you can cool the burn until it stops hurting, all the better for you. There's less chance of severe underlying damage then. Respiratory burns, breathed in hot air, okay, like in fires and things like that. Burns around the face, singed nose hairs, soot in the mouth or nose, difficulty breathing, pain while breathing, any loss of consciousness as a result of the fire. Always breathing problems, dyspnea, difficulty breathing. Apply oxygen if trained to do so. Administer CPR if rest required, and rapid transport to hospital. Chemical burns may be some of the worst and horrific burns you come across. Okay, chemicals such as acids can come into contact with the skin, can cause the skin to be burnt away. Whereas remember that alkalis are actually more corrosive sometimes than acids, and also need to be treated with care. Chemicals, we need to flush at least 10 minutes. If it's the whole body, I would suggest something like a deluge shower. Cover with a dressing and arrange transport, rapid transport. Chemical burns or chemicals in the eye, we always flush for at least 20 minutes. Hold the eye open and allow the water to flow over the entire surface. Loosely cover the eye with gauze or bandages and arrange rapid transport. Always with electrical burns, expect to find an internal injury, massive internal injury, entrance wound and an exit wound. The important thing to remember when treating a patient with an electrical burn is to ensure that the source of the power has been isolated. With electrical burns or shocking, there could also be cardiac damage or rhythm damage to the rhythm of the heart. Cardiac arrest may occur, so be prepared to do CPR. Okay. always monitor ABCs on electrical burn patients. And then once you've treated the ABCs, check for 2 burn wounds. Always treat both burn wounds. Multi-system trauma, trauma that affects the whole body, multiple injuries. Okay. Stop the bleeding, arrange rapid transport for hospital.